So it sort of isolates the sick part of the brain and stops the epileptic activity from attacking the normal part of the brain.
Some of the multi-syllabic terms like hemispherotomy can sound scary in themselves, but in addition, in this case, we refer to an operation that disconnects the cortex or outer layer of one half of the brain or hemisphere from the other, but without removing it, so both halves can't talk to each other. This is an amazing procedure which can cure epilepsy in many children, as well as both save and improve their lives, which epileptologist Georgia Ramantani is here to tell us all about.
I'm Georgia, and I'm a pediatrician, pediatric neurologist, epileptologist, and I work in Switzerland, in Zurich, at the University Children's Hospital, and I have been working in epileptology and in the field particularly of epilepsy surgery for quite a few years now, because this really interests me, and it's great to see that people, children, families profit so much for this kind of intervention.
I can certainly appreciate, as a former child, well, I say former, I'm not quite sure to be honest. I certainly, with an epilepsy at the time, I totally appreciate the value of an epileptologist who specialises in helping children, because it's and also because it's a very different sphere in paediatrics compared to adults.
It's not just about the child, so my patient is actually the child, or should be just the child, but my patient is the whole family. It's the parents and the grandparents and the teachers and everyone surrounding this one child. It's quite different.
So our topic today, is going to be hemispherotomies.
Mm-hmm.
This is really exciting. So could you just tell everybody a little bit about them? What defines one? What's the difference also between a hemispherotomy and hemispherectomy as well, please?
The big difference is that this hemispherectomy is the kind of surgery where a hemisphere is removed, while in hemispherotomy it is just disconnected. And it's the historical evolution of a procedure, because at the beginning neurosurgeons thought that they had to actually remove the hemisphere, and then down the road they realized that they don't actually, or if they do remove the hemisphere, then there are some side effects, and then the patient is not helped that much, because at the beginning the goal was to treat patients with extensive tumors, then later patients with epilepsy. And for the patients with epilepsy, different approaches were developed to make this kind of treatment not just effective, efficient to stop seizures, but also safer.
So is it like an alternative to a hemispherectomy? So chopping the bit in the middle rather than removing a whole half?
Mm-hmm. So I don't think that anybody is doing a hemispherectomy anymore, and everybody is doing different approaches of disconnection around the world, and there are different techniques, but the main point is to really disconnect the two hemispheres. And hemispherotomy candidates are usually children.
Yeah.
Because they have this kind of epilepsies that they have an extensive epileptogenic zone, and the seizures start very early in life, and they usually also have some neurological deficit, hemiparesis, and hemianopia, and then they undergo surgery earlier or later, depending on their situation, the etiology. Yes. But most of them actually do well in the end, and this is the magical thing. It sounds like a big, messy kind of surgery, but then there is a happy end down the road.
So it involves chopping the bit in the middle, but why is this beneficial for patients? Like, does it prevent seizures from spreading to become secondary generalized? What's the benefit of this operation?
Well, the benefit is that it stops seizures from reaching other parts of the brain that are normal. So it sort of isolates the sick part of the brain and stops the epileptic activity from attacking the normal part of the brain. Mm-hmm. So it sort of stops the seizures, but it also gives it optimizes cognitive development or functional development because of stopping all this negative effect.
Are these children likely to still have seizures, but just not as severe?
In epilepsy surgery, we have it's sort of black and white. So we have this angle 1A, which is the best, no seizures, never again, and probably, hopefully, in most cases, stopping drugs. And then there are all the others, and all the others also profit from surgery, of course. But particularly in hemispherotomy, the chances of becoming seizure-free are actually very high. They are higher than in most other surgeries. So it's so the goal of becoming really completely seizure-free and maybe also stopping the drugs is achieved by 70-80% of patients.
Wow.
In many of them, the drugs can be stopped either a couple of months after surgery or a bit later. But so let's say the best result is achieved in such a high rate of patients that yes, there are also the others who have a decreased number of seizures or where the seizures are not so severe. But I mean, it's this kind of surgery really benefits many of the candidates, and I think that the main question is who is a candidate, because it is a very big surgery. It sounds probably very dangerous.
Is it very dangerous? I would have thought that if it was so dangerous, don't you weigh up the risks and the pros and the cons? So, I mean, sorry to interrupt, but I'm just thinking, like, people often think, "Gosh, that's so dangerous." But how do you measure danger when it comes to this surgery?
Well, we usually measure danger by mortality, people who die during surgery or right after that, or morbidity, any kind of side effects because of surgery, and these are actually low. These are very low, and so mortality. I mean, I'm lucky that I'm not a neurosurgeon because neurosurgeons don't like to talk about mortality, but the rates are like super low, and morbidity. So any kind of side effects that you may have, that children may have after this kind of surgery, yes, there is some morbidity, but the rates are not that high, and let's say it's not such a high price to pay for this extremely high rate of seizure freedom throughout this patient group. And the interesting part I find is that all of these risks are of course higher the younger the children are, because this kind of surgery is also done in children at the age of 2-3 months, so young babies.
Wow, that's tiny. They're tiny. Gosh, like imagine like the tiniest little. Sorry, I don't want to get people like really nervous, but the tiniest little. Oops, a daisy. That's a tiny brain. Okay.
Of course, the risks are higher because they are tiny, as you said, so they have very low blood volume, and it's obviously much more difficult for the neurosurgeon, but they also do well. But I would say that nowadays risks of this kind of risks of mortality, morbidity concern particularly these very young children. But on the other hand, if a child has seizures in their first days or weeks of life, and we know that this is the best cure, or this is the cure, then we do have to offer it, although the risks are higher.
Because often isn't the risk of doing nothing actually really high? So you have to weigh up, okay, not having surgery, what are the risks of the ongoing seizures versus the risk of having surgery and having no seizures and actually living a longer life. I mean, statistically obviously it depends on the individual and age of the child, but as a general sort of statement, would you say that the life expectancy of a child increases with this surgery?
I would say that most of them actually become seizure-free. Many of them will have their drugs stopped. They are doing better than before surgery on a group level. So in In the case of all of these treatments, of course, it's on a group level because we cannot give so much detail on the individual. But sure, I mean, having continuous seizures is definitely not good for the brain or for cognitive development or for function or for anything. And especially at a very young age.
I would select to have that if I was a child in the situation as a generalization, because the impact of the epilepsies and seizures on a child's life are huge, and that's only if you have like a couple a week or something like that. But if you're having several a day or something, so the children who are suitable for this hemispherotomy surgery, do they tend to be kids with the sort of rarer genetic epilepsies?
These are children that have big hemispheric lesion, so half of their brain is damaged.
Okay.
Most of the children have been born with, let's say, a big stroke, or they have a brain malformation that is very extensive and covers the whole hemisphere, or they have, so the third category are these progressive diseases like Sturge-Weber or Rasmussen syndrome and encephalitis, and these children may all profit from this. So actually, in most cases, these are children that have an epilepsy starting in the first, if not days, but at least weeks or months of life. Mm-hmm. They already have a major disability because of the hemiparesis, hemianopia. Most of them will have some kind of cognitive issues, behavioral issues, and then at some point we decide to offer them surgery, and of course this depends on the time point where the seizures become increase in frequency or in severity, and they take a huge toll on the life of the child and also the family. There is this slogan of life with half a brain. So life with half a brain can be actually great for these children. And not just for the children and their families, but also for the children when they become adults. And the most inspiring case is a patient of mine who is now 23 or 24. And she had this surgery when she was 15. And it was a very difficult decision, but afterwards she was doing great, and the seizure stopped, the drug stopped. She could actually finish school and start working. And so all of this story is left behind. The nightmare of having seizures, of having the surgery, is left behind. She's having a great time. And we had this discussion the other day, and she told me that the worst thing for her were the seizures that she had before surgery. So she's still having a hard time coping, not with the surgery itself, but with the seizures that were finally stopped by surgery.
Is it the emotional impact of those or the cognitive impact of those?
The emotional impact of all these seizures that she had up to a certain time point where she finally got the surgery.
Wow.
So the surgery was basically the end to a nightmare. And she does not remember so much about the surgery anymore. So the surgery basically opened a door to a different world, a better life. And the part that it still worries her is the nightmare that she experienced before the surgery with all of these seizures that she had.
Thank you so much for joining us, Georgia, and giving us a bit of insight into the hemispherotomy type of surgery. I understand why that scares lots of people, but it's a very exciting thing and can truly, like you said, improve a patient's quality of life and the quality of life actually of the loved ones too. So thank you so much.
Thank you.
Make sure that you tune in next week to hear part 2 with Georgia, where we shall be hearing all about both the positive changes and sacrifices made when a child has a hemispherotomy, the short and long-term impacts, and why on earth, despite a person still having excess electrical activity in one half of their brain, they are not experiencing epileptic seizures.